My name is Kenneth Leonard, and I'm an associate professor in the Department of Agricultural and Resource Economics here at the University of Maryland. Most of my work has been in Africa. I do a lot of work in rural Africa, which is why I'm an agricultural economist. And then quite a bit of my work has been on the demand for healthcare services in rural Tanzania. But I've worked in a number of other African countries and on other things other than just healthcare. I think one of the important questions is how humans will adapt to changes in the environment, and in particular how poor people will adapt. And I do a lot of research on the mechanisms that poor people use to process the information that they have about the choices that they can make, and then how they adapt to those choices. And a lot of my research has shown that there are ways to improve people's ability to adapt, not just to change the technologies that they can choose from, but to help people learn faster about changes in their environment. I'll be talking about an area in rural Tanzania where I did research where people are choosing between healthcare providers, and those healthcare providers are changing. So sometimes a doctor who works at a facility near them will leave and a new doctor will come, and they don't know if that doctor is good or not good. And they need to learn whether or not that doctor is a high quality or a low quality doctor. And so we're looking at changes in their choice set and how they adapt. And I'll be talking about evidence that they talk to their neighbors about what their experiences are with that doctor, that they change the types of illnesses for which they're willing to visit that doctor. Then after a while, as they learn more and more about the doctor, they end up making better choices and have better outcomes as a result of learning about the choices that they have. As an economist, I enjoy the fact that we use models that give us very strong predictions about the way we expect people to behave. And I enjoy, my background in Africa allows me to go to places where no one but an economist would expect people to act rationally, right? You would describe the kinds of decisions that people were making almost in any way except using economic models of rational behavior, where rational means making really the best choices given the available set of choices. And I enjoy going to these types of settings and showing, in fact, that these people do behave quite rationally, and using that information to improve our understanding of the way humans make decisions, and then also bringing it back to improve our models about how we understand how people make decisions. So in this setting we find that people are more likely to visit, they're more likely to visit better doctors. And so over time they do learn that a doctor is very good, but what we find is it can take a long time for them to learn about whether a doctor is good or bad, in some cases up to 4 years, before they know that the new doctor who has arrived at a facility somewhere near them is actually a good doctor, or compared to other doctors maybe who are providing lower quality care. And so this confirms the theory that it matters to them and that this information is really useful, and that when they have it, they use it. But it also shows that that's far too slow. 4 years is too long to be learning about something in that type of a context, and that in this type of a setting we hope that we can find policies that would allow them to learn faster. I mean, the obvious answer seems, well, we should make sure that all of their doctors are good doctors, but no one's been able to figure out how to do that yet. But what we should be doing instead is giving them tools, or what I call rubrics, which allow them to learn faster. And that kind of finding is really important in all settings where we expect people to adapt. That yes, it's important to do research to improve the technology that people can choose from, but it's also important to do research to improve the technology that people use when they're learning about what choices they can make. The practical implications are that the healthcare system in Tanzania needs outside intervention to maintain quality, because demand from consumers is not sufficient to keep quality high, because they adapt too slowly to changes in quality. And then the second practical implication is that, as I said earlier, one hopes that there are tools that we can use to improve people's technology. But it is the case that even in a very difficult setting, people are learning and making their lives better using the information that they have. So we find that in this, and I'm working with a group of people who, one might make the mistake of considering them, technologically backwards. To an outsider, they look very unsophisticated. They always wear, they refuse to adopt almost any modern technologies that are available to them. And so it would seem that they are just an anti-adaptation society. Whereas in fact, we find that they are very adaptable. It's just that the choices that they have are highly restricted. As I've hinted earlier, I think the way to move forward, showing that that the people in this society are learning, is very useful. And I think the way to move forward now is to look for tools that help them to learn faster, giving them, rather than trying to solve the problem for them. So right now, most policy is concentrated on saying we don't expect them to learn, so let's pretend that they're not learning anything and that they can't solve their own problems. So how do we bring in solutions from the outside? Those solutions are failing again and again and again. So it's not working to bring in solutions from the outside. So once we find that there's a source of energy from inside, then the question is, how do we use this source of energy? How do we leverage it so that they can make a bigger difference in terms of improving their situation? What kind of tools can we give them that would allow them to make a bigger difference?